Good evening. This is Congressman Brad Sherman. Welcome to our seventh in a series of San Fernando Valley telephone town halls. This is the seventh telephone town hall of this spring, a spring that has brought America far more challenges than we expected. We are dealing still with a COVID crisis. We are dealing with a massive increase in unemployment and downturn in our economy, and we are still dealing with the excruciating pain of watching George Floyd die and focusing our attention on the systemic racism that has lasted in this country all too long. So we'll cover what we can of these three topics. It's hard to cover those three topics in an hour or in many hours. We will have another telephone town hall, and we've been doing these every 2 weeks, but the next one will be 3 weeks from today, July 7th at 7 p.m. Now, I want you to take down a particular phone number. If you get cut off during this call, you can dial back by calling 877-229-8493 and enter PIN number 13402. Once again, that's 877-229-8493, PIN number 13402. So this is our San Fernando Valley Town Hall. It's like a conference call, only we have many thousands of people joining us tonight. And you can sit back and listen, or you can get in the queue to ask a question. To ask a question or make a statement, you dial *3, and then you'll be put in the queue. My staff will talk with you. A few who dial *3 will just want to talk to my staff about a problem that they're having with a federal agency. But most people who dial *3 will want to be in the queue to ask a question. And I'm going to make a short opening statement, and then we're going to hear from our guest panelists here today. We'll also have some survey questions, so that even if you're not able to express your opinion by asking a question or making a comment, you can be included in our valley-wide survey on important issues that are facing us now. We will be joined about 30 minutes from now by Assemblyman Jesse Gabriel. Jesse's been representing most of us in the southwest San Fernando Valley, really in the south and the west central San Fernando Valley, most of the west San Fernando Valley. And he will talk to us about what the state's doing, but most especially about EDD, the Employment Development Department, because in providing assistance to people during this pandemic, we've had three large programs that affect average people. We've had the PPP program for small business and nonprofit organizations. We've had the stimulus payments that have gone out from the IRS, and we've had unemployment insurance payments massively expanded. The federal government picks up the tab, but the state administers the program, and that's why Jesse is the person that you'll talk to about that. And also, Jesse Gabriel's office is available to you should you want him to iron out a problem with EDD or any other state agency. We will also be joined back by popular demand, Dr. Lynn Goldman, who has been on several of our calls because of her expertise in the COVID crisis and epidemiology. So the one thing I want to cover in this opening statement is our response to policing. 8 days ago, I was part of a small group that joined at a press conference and introduced the Justice in Policing Act of 2020. This is an act being spearheaded by the Congressional Black Caucus. We went to Emancipation Hall, where we kneeled for 8 minutes and 46 seconds, and then proceeded to unveil the bill. What does this bill do? It provides for better training to end racial profiling and to lead to de-escalation. It bans chokeholds. It bans no-knock warrants in drug cases. It says that deadly force can only be used as a last resort, and that officers must use de-escalation techniques first, and that deadly force can be used not when it's reasonable, but when it's necessary. And it limits the transfer of military-grade equipment to state and local law enforcement, requires federal uniformed police officers to wear body cameras and dashboard cameras on their marked cars, and really pushes cities and counties to do the same across the country with the risk of losing federal aid. It gets rid of the qualified immunity provision that has allowed so many police departments to avoid liability, and says that the plaintiff doesn't have to show willfulness. It's either willfulness or recklessness. Gives subpoena power to the Department of Justice Civil Rights Division. Empowers community-based organizations to move toward dealing with some of the problems the police deal with now. Has law enforcement accreditation standards for the entire country, and makes lynching a federal crime, while improving transparency and creating a nationwide database of those officers with repeated use of force complaints and reprimands. I should point out that today President Trump did sign an executive order that does a few of the things that our bill would do. It eliminates the use of chokeholds, except where the officer is targeted with deadly force. It does create a national registry to track police officers with multiple instances of use of excessive force. But that's pretty much all it does do. Now, there's considerable discussion about defunding police. That, in a way, this is going to sound strange. In a way, that's being done, and all the Republicans voted to do it. Now, I realize that will sound odd, since Republicans are on Fox News talking about how Democrats want to defund police, and Republicans are want to fund them and help them. The fact is, COVID will defund our police and all other state and local government functions to a very substantial degree, unless the federal government gives state and local governments aid. The federal government can borrow and print money. State and local governments cannot. So this COVID crisis, and I know some of the sales tax is coming into the city now. There are some people at the malls. You can sit at any other table if that's what you want to do at a restaurant. Sales tax is down, and I know that. I have a feel for that, at least, because I used to run the sales tax agency in the state long ago. And I expect commercial real estate values to decline. That will also affect state and local revenue. So there's a decline in state and local revenue. Nationwide over this year and next year, it should total $1 trillion. Democrats voted overwhelmingly for the HEROES Act, which was designed to replace that revenue. All Republicans voted against it. And so if that vote holds, we will have defunded state and local governments by roughly $1 trillion, and about a fifth of that goes to our first responders. Other large chunks go to schools, roads, etc. So while you would think, flipping back and forth between Fox News and MSNBC, that it's the people watching Fox News that want to fund the police, and those watching MSNBC who want to defund the police. The fact is, when it comes down to voting, it's a little different, because if you fund state and local government, that allows state and local government to continue to provide services. If you don't, then they won't. Now, of course, it's up to state and local government to reconfigure their budgets, to reappraise their priorities every year, and to see if there's new ways to meet existing needs. But if we do nothing, then schools and first responders and everything state and local government does will be substantially defunded. With that, I want to introduce our first guest. It is Dr. Lynn Goldman, Dean of the Milken Institute School of Public Health, funded by the Milken family of the San Fernando Valley. She is an American public health physician, pediatrician, and epidemiologist, and she's a member of the National Academy of Medicine, has served on numerous committees, and is on the advisory committee to the director of the CDC and the FDA. So with that, Dr. Goldman, where does this virus stand?
Well, from all that we can tell, the virus itself is doing pretty well, but we are starting to make some progress in our battle against it. And I did want to share some of the news about that because I'm pretty excited about it myself. One of the things that is kind of breaking news this week is that in the UK, they completed a very rigorous clinical trial of a drug that is very familiar to us in medicine, dexamethasone, a corticosteroid drug that does seem to have some very powerful properties in terms of treatment of people who have a severe form of the infection. At least a good fraction of people treated with the dexamethasone in the UK, those on the ventilators, a fair number, actually a third, their lives were saved with this medication. Those not on ventilators but needing oxygen, there was even a benefit for those patients. And so I think that's really good news.
And doctor, it's my understanding that this disease, sometimes the virus is the problem, but sometimes it's the body's own response to the virus, the massive response of your immune system, inflammation, and that this steroid that we've known since the 1950s has been shown to be beneficial in toning down that immune response and preventing the inflammation from leading to deaths. Do I have that right?
That's absolutely right, and which means that the timing of the administration of a drug like that is very important. You would not want to be suppressing your immune system during a time when you might be exposed to the virus. There's a good chance when people are first exposed that your body's natural immune system can fight off the virus, especially if you get a small enough dose. But when you have a pneumonia and you've gone into a process where there's a cascade of inflammation, then a drug like dexamethasone can help to, if you may, kind of quench that fire, because that in itself can start creating tissue damage to the lungs that can be have very serious consequences. Many of my friends who are clinicians were telling me they thought this drug worked, but this is proof of it, that it actually went through a randomized, controlled clinical trial, that we can really kind of take that evidence more to the bank than just, well, it appeared to be that it was benefiting people, because, of course, some people just get better on their own. So that's a piece of good news. And as we discussed the last time that I was with you for one of these town hall meetings, we are continuing to see progress also with development of vaccines. And I think that's very exciting as well. In our own institution and many others across the country have been organized by the National Institutes of Health to be the sites for very large clinical trials that will be conducted of up to 5 vaccines that the NIH is supporting industry to develop. And those are beginning to roll into the clinical trials process, with the first one starting in July. And I think that's also very good news.
And in these calls, I tend to give people the latest statistics. Nationwide, just in the last 3 days, we've seen a bit of a decline in the number of new cases. But in general, looking out many days, it's about 20,000 new cases a day. In terms of new deaths, it was running about 1,000 a day. The last few days has been more of an average of 500 or 600. So that's good news over a few days, but I don't know if you can extrapolate much over a few days. As to California, the latest California numbers show new cases running at around 2,500, even 3,000 a day increase. A number of cases detected per day. The number of deaths in California down, yes, to the most recent day it was 26, but in general running at about 50 a day. LA County new cases running right around 1,000 a day. Deaths running 25, 30 a day if you look on average. And in the San Fernando Valley, new cases running at 100, 150 new cases a day. Nationwide, we're doing a lot more tests. That there is an argument that we're continuing to report like 20,000 new cases because we're doing more tests. The percentage of the tests that are coming back positive nationwide has dropped from 19% to 9%. So more and more people who are being tested are not positive. That's because we're doing more tests. But this disease is still with us. It's still 20,000 new detected cases and 1,000 deaths a day nationwide. The substantial improvement has been in the New York City area, where it was hit the hardest, and now they finally have a handle on it. But in other parts of the country, including California, this is a stubborn disease. So, Doctor, what else can you tell us, and how important is it to wear masks?
Well, so I just want to make a comment about California, because even though the rate of improvement is not as fast as what we might see as occurred in New York, but I think that California has been more successful, obviously, than New York and some other areas in generally flattening the curve, and that although the decline isn't steep, most of the trends are really going in the right direction. And even in LA, where the rate of infection is still higher than I think we would like to see, but that is coming down. And I think one of the very important things has been, as you say, that learning that we need to wear masks when we're out in public, that we need to do social distancing, but learning that we need to have more capacity for testing and for contact tracing. And California and LA, have met those milestones in terms of building their ability to do that. Learning that we need to have reserved bed capacity and other capacity in our healthcare system to be able to take care of people if we do have outbreaks. And I think California has been able to do that. I think LA is in a good situation with that. And then, now, how are we going to be able to move forward with gradually going back to opening up the economy. And there's where the social distancing, that masks are going to be very, very important. When we go out, if we're all wearing masks, we're not, if you may, polluting the air with the droplets that are coming from our own bodies, because we can carry the virus without being aware that we have it. And so this is really something that we're doing for other people, and to make the environment for other people safe. And if they're doing it, it makes it safe for us. And so it's kind of a nice
and it also benefits the mask wearer, both in terms of you're less likely to breathe in the virus particles, but also you're less likely to touch your nose and mouth in your face if you're wearing a mask. So do it for yourself, do it for everybody around you, do what you can to get everybody around you to wear a mask and do the social distancing. Doctor, cloth masks versus the surgical disposable masks, both about the same, or is one better than the other?
I think that they're close. I think that some of the cloth masks need to fit well enough, tightly enough across your face. They need to go all the way up to the bridge of your nose and down to below your chin. And so pulling the mask down below your nose, it doesn't work that way, which I see some people doing. But I think that the cloth masks have some advantages in terms of the fact that you can reuse them. You do need to wash them, but you can reuse them. And whereas the surgical masks are disposable. And I also think, though, that they not only need to fit well, but the World Health Organization is now saying that you really want to have a mask that has up to 3 layers, and that will provide better filtration. And so that's something that we can all look at. But, we can make those, we can have them made. They're often now offered.
And Doctor, I want to remind people, if they have a question, to dial *3. And I'm going to go with a survey question now. Then we're going to take an oral question from the audience. And then we may use an RSVP question. And then we're going to go to Jesse Gabriel, our second guest. So here's the first survey question. Back in April, May, we sent out stimulus checks, or actually it was mostly direct wire from the IRS, $1,200 per adult, $500 per child. There's talk that we might do a second round of these stimulus payments. That, of course, adds to the U.S. deficit. On the other hand, it puts money in the pocket of everyone who makes less than $99,000 for a single person, or $198,000 for a couple. So the question is, do you think we should do another stimulus round? Press 1 if you think yes, 2 if you think no, and 3 if you're unsure. With that, let's take a question from our audience.
Okay, Congressman, we have Dr. Ross from Tarzana, who I believe has a question for the other physician on the line.